Stop thinking about them. So the question is, why do some people have a sweet tooth and others don't? We're starting off with that today on Wellness Wednesday. To answer that question, along with some other hot topics making medical news, please welcome our panel today: orthodontist Dr. Vladimir Tabakman, orthopedic surgeon Dr. Philip N. Williams, and hormone specialist Dr. Stephen Hotze. Okay. By show of hands, who has a sweet tooth? Oh, okay. I was good. The orthodontist does not have a sweet tooth. That's good. All right. So why is it that some people just can't get enough of the sugar, and other people, it's like, I like salty, savory things?
Well, you know, the article that they referenced talked about a gene that certain people have and certain people don't have that make them more susceptible to sugar. But the long and the short of it is, when you eat sugar or you eat simple carbohydrates that are quickly converted to sugars, all starches are
potato chips, they're salty, we'll go to sugar.
Right, well, starch is glucose molecules hooked together. So as soon as you put it in your mouth, it gets converted to sugar. You get sugar highs, and then immediately you make insulin, and then the sugar drops, and you get sugar lows. And that causes the craving in most people. Is just the fact that they're not eating properly. So if they will eat a diet that eliminates sugar, eliminates your simple carbs, and they'll do that for about a week, they'll find out they'll feel so much better, and they'll be leveled out as far as their moods and their energy.
Yeah, you're absolutely right about that, because whenever I eat the right thing, I don't want the wrong thing. Right. And for me, like I said, it's more savory stuff like chips and stuff. But if I eat the right thing, your body says, okay, thank you for the nutrient-dense food, we can function now, right? All right.
I would say additionally, sweets also kind of trigger the reward and demand pathway in the brain, and helps with addiction almost. It's like an addiction to sweets where you feel like you need the
people have said that withdrawing from
like
sugar is like withdrawing from like hardcore drugs.
They've done studies in rodents where they give them cocaine for certain days, and then they'll give them sugar, and then when they give them a choice, they pick the sugar.
Yeah.
That's hard to believe, but they do.
Like I just saw, Thomas, our director, wait, go back to that shot that you just did. I just wanted to point out, for those of you who said that I was like chubby, I have started working out and things are changing. All right, can you tell when someone opens their mouth that they eat a lot of sugar?
Well, absolutely. I mean, we can see, increased amount of decay, plaque, tartar on the teeth. And I think, as other doctors said, this article also mentioned the addiction factor and that particular gene. So what they also found is that people that are addicted to more sugar, in this article also said that they had increased intake of alcohol and smoking. So all the, additional factors to avoid.
All the vices.
Right. Yeah. So when we go to the doctor's office,
sugar, and then it's alcohol and smoking.
We go to the doctor's office and they say, "How often do you drink?" You're like, "Oh, just every holidays." Right? Yeah. Well, how many holidays are you having? Okay. Okay. This next one here actually says, "Can swearing increase your physical strength?" Which is kind of like when people just have this outburst. Like, have you ever seen that guy in the gym? Okay, let's take a look. Let's take a look. Yeah, there you go, Lou Ferrigno. Okay, I have to admit, I started doing that myself. But okay, so basically, I think is kind of equating it to just having an outburst of some sort. Could that actually increase your physical strength?
Let me mention something. They talk about swearing, and when I think of swearing, I think of taking God's name in vain, and it's clearly told in the scriptures, "Thou shalt not take the name of the Lord thy God in vain."
Oh, there's some other names, though.
Oh, yeah.
There's some other words.
I think it's probably not a good habit.
Yeah, right. But it's like the psychological impact, though, because usually when people would do that is when they're mad, right, or charged.
Right, and many athletes, you would notice on different sports, you would see them swear, have a big outburst, and many times that's their response to an activity that actually triggers some adrenaline and gives them that rush. And it has a protective side effect, too, of protecting you from feeling the pain from any injury that you may have, and actually gives you that burst of strength and energy at that time.
Which is kind of when we go, ow, 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 right? When you're hurt, and it kind of, somehow we think it helps, right? All right.
What's interesting, too, in that article, it also says that over-cursing actually diminishes that particular painkilling effect of,
so you have just the right amount of cursing.
Exactly. It's like I heard a good saying that cursing is like a good wine. It should only be uncorked on special occasions.
When you really mean it, right? You want people to understand. Okay. There's a couple of things that are happening right now with dental care that's kind of interesting online. Of course, online you can find everything, right? And it's about people who are doing their DIY braces using rubber bands and doing all, fishing line, paper clips.
it's crazy. So, you know, obviously we live in a day and age where you want something now, you want something yesterday.
You want it cheap.
You want it cheap. I think we're all guilty of that. I mean, I've done it. You want something, you get your phone and you say, there got to be an app for that, right? Yeah. So nowadays you can find thousands and thousands of videos online on how to do it yourself. It's a new craze with teenagers, kind of see it at the office, and, you know, these beautifying projects, even though they could appear easy and cheap, but it's no such thing as easy and cheap.
Yeah, and the problem is you can cause some real damage, because when you're going to an orthodontist's office to get your braces and stuff, you watch the movement of the teeth and how fast they move, because if they move too quickly, you could end up losing some teeth.
Yeah, there's biological, physiological factors to what we do. So, you know, you can definitely cause some irreversible damage. You can lose some teeth. So I think important thing to remember is that, you know, you get one set of teeth. Yeah. And, you know, they're important to your health and self-image. So anything to do with health is not a good do-it-yourself project.
Yeah, right. Yeah, just because you can't do it yourself doesn't mean you should do it yourself. Okay, this next one's kind of interesting. Women's brains shrink during pregnancy. It says that pregnant women lose gray matter and areas that deal with people's feelings and nonverbal signals, and it appears to make the brain more efficient at that time when they're not worried about everybody else. Because let's face it, if you've been pregnant before, you have a baby, your body, it is all about that baby, right? You have no room for anybody else.
Interesting. They said they didn't know if it lasted after the baby was born. I don't know why they didn't do another MRI to just check and see if it made any difference. But it's an interesting finding.
Yeah, but
what do you say? That's about it. What do you say?
Yeah. Okay. Well, I'm sure that mine shrunk somewhat and probably stayed that way. All right.
Well, I mean, I think that's why it makes you know, maternal instincts. You know, I mean, as a father of 2 children, I can say, you know, mothers are a lot better at it.
Oh, thank you very much. Okay. Up next.